How can you tell Parkinson's tremor from essential tremor? Imagine trying to distinguish two similar but different kinds of shaking that can affect your body. One might seem familiar, but understanding the key differences can help you and your doctor figure out what's going on. Parkinson's tremor and essential tremor are both involuntary movements, but they have distinct features that set them apart. Parkinson's tremor usually happens when your muscles are relaxed. For example, if your hands are resting on your lap or your sides, you might notice a slow, rhythmic shaking. This is called a rest tremor. It tends to be most noticeable when you are not actively moving. In contrast, essential tremor often occurs when you are moving or trying to hold a position. For instance, if you are reaching for a glass or writing, the shaking becomes more evident. This is known as an action or kinetic tremor. Another important difference is where the tremor begins and how it spreads. Parkinson's tremor often starts on one side of the body, like one hand or arm, and may gradually involve the other side. It can also affect the chin, legs, or face over time. Essential tremor, however, usually affects both sides of the body from the start, especially the hands, and can also involve the head or voice. The speed and strength of the tremor also differ. Essential tremor tends to be faster, with a higher frequency of about 8 to 12 cycles per second, and the shaking is often less intense at first but can grow stronger. Parkinson's tremor is generally slower, with a lower frequency, but the shaking can be more pronounced and sometimes more noticeable. Looking at other symptoms can help tell these conditions apart. Parkinson's disease is a complex disorder that includes stiffness, slowness of movement, and balance problems. People might also have a masked facial expression or difficulty starting movements. These additional signs are usually not present in essential tremor, which mainly involves the shaking itself without other neurological issues. Family history can also offer clues. Essential tremor often runs in families, with about half of cases having a genetic link. Parkinson's disease has a lower familial occurrence, affecting around 10 to 15% of cases. The underlying causes are different too. Parkinson's results from the loss of dopamine-producing cells in a part of the brain called the substantia nigra, which affects movement control. Essential tremor is thought to involve abnormal activity in the cerebellum and brainstem, but scientists are still studying its exact cause. To accurately diagnose which tremor someone has, neurologists look at when the tremor occurs, where it appears, and what other symptoms are present. They may perform neurological exams, review family history, and sometimes order imaging tests like dopamine scans or brain MRI to help confirm the diagnosis. In summary, if your tremor mainly happens when you are resting and is accompanied by stiffness and slow movements, it is more likely Parkinson's tremor. If it occurs during movement, affects both sides equally, and you do not experience other neurological symptoms, then essential tremor is probably the cause. Always consult a healthcare professional for an accurate diagnosis and personalized advice, as each person's experience can be different.